Some of the genes that are affected have to do with things like how are hair follicles maintained and how is normal skin maintained. And if you disrupt that, during normal wound healing, there are stem cells in the skin and in hair follicles that help to regrow the wound, help heal the wound, and then regrow a normal skin sort of scar surface again afterwards.
Thanks so much for tuning in to this week's episode of The Skin Reel. This week, I want to talk about a chronic, painful, and really debilitating skin condition that you have probably never heard about. And that is the condition known as Hidradenitis Suppurativa. And to keep it simple, I'll probably just call it HS. And this condition is likely more common than we know. It's just not talked about. And that's probably because of how it affects people. People, and tends to be women, will get these painful, what look like abscesses, these nodules. They tend to be along the groin or armpits. They can drain, they can smell, they can scar, and it can leave the skin overlying it really scarred with these things called sinus tracts, or little tunnels under the skin. And so when people develop this, they frequently feel like it is due to poor hygiene, or that they are contagious, or they're infected. And it can be really embarrassing and stigmatizing for people with this condition. And oftentimes they don't even want to tell their spouse, their friends, their doctors that they have it. And I think that's why people don't hear about it, because it's not talked about. It's a condition that people sort of suffer through. They feel shameful about it. And that's why I want to talk about it on today's episode with an expert in hidradenitis suppurativa, Dr. Chris Syed. He is a dermatologist. He practices at UNC in North Carolina, and he is really on a mission to help these patients that have oftentimes been forgotten by the medical community, by pharmacology companies. And he is trying to help bring light to this chronic condition so that we can really help people, and hopefully help people with this condition before it leads to that sort of debilitating scarring that they can get. And I also love how Dr. Syed is going to do some myth busting about HS and teach us really the facts and the truth about it, and dispel some of these misconceptions. So if you have ever struggled with abscesses, especially along the groin or under your armpits, or know a friend or a loved one who might have this condition, you are definitely going to want to stay tuned to learn more. Dr. Syed, thank you so much for being here. I'm really excited to talk about this really important condition today that a lot of people don't know about, but it's out there, and we really have to get the word out there. So thank you so much for being here.
Yeah, very glad to do it. I'm always excited to talk about hidradenitis. I can say HS just to keep it easier because it's a mouthful to say hidradenitis suppurativa, but I appreciate you having me.
I love that we get to have a real expert who really has an interest and an expertise in treating and managing this chronic condition. So can you just break it down for us? What is, we'll call it from here on out HS, but hidradenitis suppurativa?
Sure. So, and this is like, I know the title of this episode kind of refers to the fact that even though HS is so common, like most people have no idea what it is at all. So what it basically is, people develop painful nodules, abscesses, and over time they have a lot of scarring and often lesions that sort of chronically drain pus, typically in places like the underarms, groin area, on the buttocks, or under the breast. And so it's a disease that's very hidden from sight. I always tell people all the time that you have met other people with HS, but you have no idea they have it because it is something that they're often nervous to talk about. There's a lot of stigmatization around it. We can kind of talk about what some of those myths are and the reasons for that. But unlike things like eczema where people can hide it, and there's not, and I think, kids have it all the time, everybody's very familiar with it. HS is one of those things that unless you have it or sort of have a close relative or somebody that's happened to talk to you about it, you probably just never had a chance to sort of have to confront it with somebody that actually has the disease. But it's very miserable and much more common than people think it is.
It occurs in these like private areas, these very sensitive areas, personal areas that people aren't going to just go around telling you like, oh man, I'm having such a flare. under my breast with my HS. Like it's not something that people go around talking about because it can be really stigmatizing. I'm sure you have met people with it. They just are either embarrassed to tell you or don't feel comfortable. Any idea how prevalent is it here in the US?
Yeah, I mean, it's a great question and something that's been up for debate over time. Like older studies that just tried to look at, what patients were diagnosed with HS, and the health system made the numbers look really, really low. And people thought for a long time it was a rare disease. But people have done studies now where they just ask the general public questions, do you develop, painful nodules or abscesses in the typical places over time? Up to 1% of the population will answer yes to those questions. And they're actually very sort of specific to HS. Like it's unusual to answer that question yes if you don't have the disease. So some say as high as 1%. It's probably somewhere in the range of like 1 in 200, 1 in 300, if I had to guess what the reality is. The other thing about it, I didn't mention before that's kind of classic about this is not a one-time thing, right? This is something people live with for decades typically. It tends to come up in the teens, early 20s most commonly, but can develop later in life. And people have it for many, many years. So it's not somebody who just gets a staph infection, they have an abscess. This is, a chronic inflammatory disease, just like Crohn's disease or rheumatoid arthritis, something that people have to cope with and adapt to and sort of treat over the course of a very long period of time, typically, and often in silence. As a teenager, you can imagine if you developed an abscess and it drained pus in the groin area, you might even talk to your parents about it. So there are kids who, will hide it for a year or two, I think, before even bringing it to a loved one's attention. And that time things get worse. And it is just, it's unfortunate how hidden it is. So I think if people in the public knew what HS was, if they had, growing up, kids were exposed in some way a little bit to have an idea what it was, or parents knew about it, or there was some dialogue around it, people would recognize that, hey, this is a problem, not just something I'm going to hope goes away, 6 months from now. But that lack of public awareness means a lot of people go undiagnosed just because it's under-recognized. Even in the medical community, outside of dermatology offices, I think it gets missed all the time by medical people.
Maybe this is TMI, but I can totally relate to the being embarrassed to tell someone about a skin condition you have. And this is not HS, but I was maybe 12 and I was at camp and I got a horrible case of impetigo, which is staph on the skin. But in my 12-year-old brain, I was getting pimples. So I had like one on my forehead, but then I really had them on my buttocks and I was mortified and I told no one. And when my parents picked me up from camp and I was miserable and my mom happened to see me changing and she was just horrified. But so I can relate to that of being not sure what's going on, feeling super uncomfortable, feeling kind of shameful and embarrassed and not wanting to tell anyone. And so, that I love that we're talking about it so people can understand like this is not something to be ashamed of or embarrassed. And part of, I think, that shame or embarrassment comes from this idea that this is from being unclean or dirty. Can you kind of speak to that a little bit?
This is a big misconception. And the most troubling thing is that a lot of patients, historically, they go to a place like an emergency room or urgent care when something like this first starts. And like, they'll be told, you need to have better hygiene. You need to make sure you shower every day. And it's like, most patients that have this condition, if hygiene fixed HS, there'd be no HS, right? The first thing people want to do when they deal with something like this is they start showering like 2 and 3 times a day, right? So their hygiene is actually much more intense than the average person actually by the time they've had disease for a while, because they are desperate to sort of find a sort of a simple fix like that. But because there is, pus, drainage, odor, people intuitively link that to some issue with like infection or bacteria or a hygiene issue. And again, that's part of where like the stigma comes from, is they may even have been sort of made to feel shame even in a medical setting. And so they withdraw from even interacting with physicians in other medical settings a lot of times. But it really has nothing to do with hygiene. It's just like if you had Crohn's disease and there's, pus and inflammation in the gut, people didn't say it's because you ate something bad, right? But there is this connection with skin and sort of, again, things like this on the skin surface that people want to make that connection for some reason.
We see this all the time. I do a lot of surgery and even other dermatologists will sometimes think something's infected because it's warm and red. And yes, sometimes that can be the sign, but sometimes it is just inflammation. And I'll try to tell people it's like a pimple. A whitehead doesn't always mean infection. Those are just your neutrophils coming in and it's inflammation rather. Probably another reason why people tend to think this is due to hygiene and bacteria and things like that is because they're, I'm sure, given antibiotics, right? Everyone's given antibiotics if they go to the emergency room for this condition because, it's warm, it's smelly, it's oozing. And so it can be hard for someone not familiar with it to realize, no, this is inflammation, not infection.
Right. Antibiotics, can be effective too. And I tell patients all the time that, like with other inflammatory conditions also, like what our bodies, interact with in the environment also triggers inflammation to some extent. And just like people with rosacea or acne can also get better with antibiotics, there is something about how people with HS and their immune system interacts with even normal bacteria on the skin surface that is different. And so if I give people strong IV antibiotics with HS, like they will look way better for 10 or 12 weeks. But as soon as you take the antibiotic away, that normal bacteria come back in again and the body starts to overreact again. So there's this link between, bacteria and an overactive immune system. It's like the body is mimicking a response to infection all the time, even though there's usually not true infection there. Like if we do a culture and try to grow off, staph and other bacteria like that, most of the time we just find normal old skin bacteria like everybody has. And there are some nuances and slight differences to the type of bacteria that will maybe colonize areas affected by HS, but they're not, like the typical things we think of as causing skin infection. So yeah, because the disease so closely mimics how our body reacts to infection, that it's a huge source of confusion, especially in the beginning. And really, if somebody comes in and they've just had a couple of sort of painful bumps or they had one abscess, whether it's on the buttocks or groin for a month or two, I might say, yeah, that could be a staph infection actually. Like we're going to try to treat it, we're going to culture it, treat it and sort of make sure it goes away, but that should clear up if it's an infection. Once it recurs, over more than a 6-month period or so, there's high suspicion that person has hidradenitis at that point.
Yeah. So can you kind of just break down what is sort of the underlying pathology? Is it the sweat glands? If it's not bacteria, like what is the underlying cause of HS and why does it have this predilection for kind of the groin, armpits, under the breast? Why those areas?
Yeah, that's a great question with an answer that's not very straightforward because I think there's just too many questions about it still. But what we know, how we best think about it at this point is it is a type of chronic inflammatory condition, like kind of like I mentioned before, just like people get Crohn's or rheumatoid arthritis or things like psoriasis on the skin. There is something abnormal about the inflammatory response in these patients. And about half of patients that have the condition have a family member with it. So there is definitely a strong genetic component that predisposes patients. Some patients have very well-defined mutations where it's like, if you get this change in your gene, you are very, very likely to have HS. And those have to do with things like hair follicle development and inflammatory response to some extent. Some of the big genetic studies that our group had just worked on also identified a few genes that have to do with how the hair follicles and normal skin cells kind of maintain and separate themselves. It goes back to the idea that where the disease is most likely to occur are places that have mostly hormone-dependent hair follicles, like under the arms and in the groin area, but we have tiny hair follicles all over our body. So in other areas where there are, in particular, places that are affected by friction, so like where a bra strap rubs is often highly affected for women, or where an underwear line kind of rubs against the crease of the groin, or patients will say, I wore a certain swimsuit, and that kind of triggered a lot of lesions to kind of get worse or come up all of a sudden. So there was probably something to do with hair follicles that predisposes to the disease from a genetic standpoint, where they rupture more easily. Bacteria maybe, again, sort of colonize hair follicles differently and allow the immune system to sort of be overreactive in a way that it shouldn't be. And I'm making this sort of like maybe more complicated than it is, but people used to think it had a lot to do with sweat glands. And I think that has kind of gone in sort of a more historical route where it's not really thought to be the main driver anymore. Sweat glands happen to be in these places, but a lot of the places we don't have those typical types of sweat glands like under the arms can still be affected by HS. People get it on the back of their neck and other places where hair follicles are present, but those types of sweat glands typically aren't. So it's more of a hair follicle disease related to chronic inflammation and probably some abnormal development and maintenance of hair follicles.
I was thinking back on the sweat gland, so this is educational for me. Usually by the time I see someone with HS, they really kind of failed a lot of therapies or they have a lot of chronic scarring from the HS, and actually their HS may be fairly well controlled, but they have the residual scars from it. And so then I will kind of go in and cut those out. But why does HS scar? If it's inflammation, how do people get these scars and these things called sinus tracts? How does that happen?
Yeah, I mean, that's another sort of like, sort of mystery part of HS, right? There's lots of other inflammatory diseases that affect the skin, or even a skin infection, doesn't typically leave the same sort of tunneling and scarring behind for the most part. And that's one of the things that really makes HS so devastating is, if you have eczema or psoriasis, we have really good medications to control those things, and the skin can essentially get back to normal after it has a chance to heal for a little while. With HS, it leaves disfigurement behind. There are sort of, it's hard to describe it and really do it justice. Anybody in the audience could Google hidradenitis and find lots of images of it, but it leaves behind these sinus tracts, which are kind of like tunnels almost the skin surface, where there will be drainage points that leak pus but they actually connect under the surface. So if like we take a little instrument, we can kind of slide that instrument into one of those openings, and it goes under the skin surface and pops out another opening. And the skin remodels in that way. And afterwards, kind of the overlying skin becomes raised and scarred and bumpy. And so there's a lot of textural abnormality in the long run. And then because, sometimes an abscess breaks through the skin and opens it up and it has to heal as kind of being an ulcer afterwards, it'll just leave, flat scars like any other ulcer would or any other sort of trauma to the skin would. So there's a mixture of scar types that happen. And when those deep tunnels develop, often chronic inflammation develops underneath those. It has a lot of trouble healing, almost like a chronic wound trapped under the surface of the skin. And some of that may go back to, this may get sort of like into the weeds a bit as far as pathophysiology, but some of the genes that are affected have to do with things like how are hair follicles maintained and how is normal skin maintained. And if you disrupt that, during normal wound healing, there are stem cells in the skin and in hair follicles that help to regrow the wound, help heal the wound, and then regrow a normal skin scar surface again afterwards. When those sort of two signals are disrupted, hair follicles normally form sort of like an invagination or like a cup shape into the skin surface. And if you have abnormal hair follicles, they sort of dilate out and form cysts, like a ball instead of a cup shape where a hair follicle grows out. So when that programming to sort of regrow a normal skin lining over the surface is messed up, I think what you get instead are these sort of pockets that become elongated and almost cyst-like. And then as they sort of try to reach back up to the surface and connect and form a sheet of skin, you get sort of a tunnel-like structure that develops instead. Like you almost have an extra layer of, like two extra layers of skin, like a subway tunnel that's been dug underneath and has skin lining it sometimes even sort of all around. And it's very hard for that to resolve on its own. Like that structure, once it's there, is kind of self-sustaining, just like the skin is. Like if you just poke a hole, it heals itself again. And because it's an abnormal structure, it is just chronically inflamed. It's not supposed to be there, so the body doesn't know how to make it resolve in a normal way. That's the worst part or the most stubborn part of HS. If people have just lesions that come and go, medications and other means can control that pretty well, and the skin can heal okay. But once these physical changes have happened to the skin that are so different than every other skin disease, that's why surgery ends up playing such a big role in managing it over time once it becomes more advanced like that. It's a physical change, and you have to physically intervene to actually fix it.
Absolutely. Yeah. Even when you are no longer having those active outbreaks, you still have that sequela from the old ones, which is different from things like psoriasis and eczema that tend to leave normal skin behind. So again, why this is such a difficult disease to manage. Can you give us sort of the profile, like who is affected by HS predominantly? Is this women? Is it men? You said it started, tends to start around the teenage years. Like what's kind of like the typical person?
Yeah, it's a great question because there are, I think you're setting me up because you know the answer to this, but it's a good thing because I want to be able to, it's a good point to make and maybe part of why I think it's been ignored as much as it has over the years. So, in general, at least in the US and Europe, we know that it's about 3-to-1 female to male. So about 75% of patients are women. And that may have something to do with potentially being somewhat by either things to do with the X chromosome or it's probably hormonally driven in some ways too. Like just like acne, a lot of women will flare the week before a menstrual cycle. And so there's almost certainly some contribution from that makes it more common in women. And then it's also probably about 3 times more common in Black people. And so, in my clinic, for example, in North Carolina, a little more than half of the patients I see are Black, and that's not what North Carolina generally looks like. So it's clearly like very overrepresented, and you see that in a lot of places. And why that is, whether it's, again, something that is genetic or something to do with, structure of the hair follicle and hair shafts being slightly different, it is not really clear, like why that happens. But it's very clearly, sort of an issue. And again, I think HS, again, not very well known by the general public, right? There's not that much awareness around it. It's also historically received very little attention when it comes to the types of medical care people got. Research, there were like no NIH dollars that ever went to HS up until about 5 years ago or so, even though it's a disease that clearly has been around for a very long time. So, why has it been ignored so much? I don't know. I mean, like a lot of women's health issues have been very ignored, whether it's endometriosis and other conditions. I mean, that's those other conditions have been much better publicized, and the disparities that have existed over time there. And I think partially also because minorities are sort of such a big part of that population. It's also, there's probably a two-way street as far as things like socioeconomic status. Patients with HS have a lot of impact on things like schooling and education and jobs over time in terms of losing job opportunities, having trouble keeping up with schoolwork because they're often, physically disabled at times in terms of what they can do. And so I think it's a population that, just has not been able to have much of a voice and influence in terms of directing what resources go to their disease over time. There are some other key features, like historically people thought that smoker was a disease of smokers. And that's because smoking used to be much more common, especially in places like Europe where some of those early prevalence studies were done. But really, it's a minority of patients now that are smokers. Like if we look at our current population, it's like maybe 20 or 30%. And if you look at the people who are developing disease, like in their teens and 20s, I mean, smoking rates are almost non-existent, right? But that's almost always when the disease starts. Or like smoking rates in teens right now are almost non-existent. There's vaping and stuff like that. But the vast majority of people who develop disease are not smokers at the time. Same can be said of obesity to some extent. That's another thing that often gets tagged to this disease is that these patients are always overweight, which is not the case. There's a lot of very thin patients with terrible HS. And most patients in their teens when they first develop disease, like really aren't very overweight. We're kind of trying to do some studies like that now because often when patients are diagnosed, their weights are noted to be higher. And I think part of that is that when you have a chronic inflammatory disease and some of the metabolic disruptions that go along with that, tendencies towards things like PCOS, patients who can't exercise because being physically active is painful, I think a lot of the weight gain come afterwards. And I think that maybe is why we see that tendency. But that's not 100% clear. There's a lot of controversy around, smoking and obesity and their role in HS. They maybe contribute some, but it is often sort of overemphasized.
Certainly back when I was in my residency over 10 years ago, that definitely was emphasized that smoking and obesity were big players. So that's interesting to see how that's changed. And yeah, you bring up a good point that kids aren't smoking nowadays, right? So teenagers, when they're getting diagnosed, are likely not pack-a-day smokers, right?
Right.
So they're or obese, and so there's got to be something else going on as well. I would love to know what are some treatment options? Are there treatment options for this condition?
Yeah, I mean, luckily that's an area where, as interest in HS has grown over the last 5 to 10 years, there have become a lot more options. Like it had been much harder to treat this disease back in like the 70s and 80s before the advent of some of the newer medications we get to use. Traditional ways to treat it had a lot to do with things like antibiotics, and that wasn't, 1-week course. That was often for months at a time trying to be suppressive. And that sometimes is helpful. I think since everybody's microbiome is a bit different, the type of bacteria on their skin can be different. Patients can respond, differently to the same and different antibiotics. So a lot of it is kind of troubleshooting and changing them over time. They are modestly effective typically though. And most of the topical antibiotics like the lotions and creams and gels we use probably have like relatively small effect overall, especially once the disease gets pretty bad. Sometimes we use things that affect those hormonal influences I mentioned earlier. So things like birth control pills or a medicine called spironolactone. Those have been used for a long time to treat acne, well recognized as ways to help control acne better. And for some patients with HS, they can make a difference. I mentioned the inflammation starting around hair follicles, and actually things like laser hair removal can go a long way for these patients and actually be very helpful early on. I think it's sort of slowing down their progression, maybe minimizing how much medication they have to be on, but it can be a fight or sort of a controversial issue as far as things like insurance coverage go for that, even though it's a much more cost-effective way to treat than most of the new medicines that are on the market now. It is something that a lot of people, are not willing to try to submit to insurance or, insurance policies don't openly sort of cover it all the time. And so you have to play the game with them to figure out if you can get it covered or not sometimes. And then the sort of biggest things that sort of have also brought a lot to attention are newer medicines that are anti-inflammatory. I think people in the general public have often heard about medicines like Humira, or more recently, there's one called Cosentyx that's been approved for a long time for psoriasis and other conditions. Cosentyx was approved a few months ago for hidradenitis, and Humira was approved back in 2015. And when it got approved, everybody thought this was like a rare orphan disease. They thought there would be like, they were doing it out of sort of compassion almost to put something on the market for it. But it's been, it ended up being so successful because they underestimated how many patients have HS that needed treatment because it was such a hidden disease. That now there's, probably 30 different drugs in different stages of clinical development for HS right now. So it's going to it's sort of exploded in terms of the interest after. The reality is, financially driven. When companies get interested, it's because there's dollar signs behind it potentially. But that also means that as they bring drugs to market, they do awareness campaigns, they try to get education out there. So it does improve the overall landscape, despite what the motivations are sometimes. And a lot of the people at these companies, are people who have been dermatologists and sort of treated these patients and are highly motivated to find something for them. So some of that was initially rooted in people, I think, also are just very compassionate about finding something for these patients that suffer so badly. So those drugs are typically like home injection type medicines. There are some pill medications in development. Most of these things are, again, long-term treatments that people have to stay on over the course of years to control their disease well. Most don't cause a lot in the way of side effects, but they have all those scary, sort of endings to the commercials that list all the possible things that could happen. So they sound scary and they're often very expensive. And then surgery is a whole other aspect of treating HS care, but I'll sort of pause there, I guess, because that's a long list of medications you mentioned to begin with.
That's really interesting about like laser hair removal, right? And wouldn't that be amazing if insurance could just cover that and then they don't have to pay for these expensive biologic therapies. That would be amazing. That's really cool. I have a question. Back in my day, right, they were using rifampin and clindamycin. Is that kind of fallen out of favor?
That's still used sometimes. Like clindamycin and rifampin are two antibiotics which have been reported as, there's been a fair number of studies showing they can be efficacious. Like there was a study a while back that showed that if you take rifampin at the same time as clindamycin, because of an interaction that happens, you end up reducing your clindamycin levels pretty quickly. So it's like you're kind of only on one antibiotic after about 3 weeks just because the levels of clindamycin get very low. So we still do that sometimes because some patients have just historically found it very helpful. Or what we'll do is we'll combine rifampin with a different antibiotic that doesn't have that same interaction. So those are very valid ways to treat disease, can sometimes be effective, especially earlier on. But long-term antibiotic use isn't always ideal. If it makes life better and isn't causing side effects, then some patients do end up on very long-term antibiotics, but often the worst patients end up needing more than just antibiotics over time.
I'm glad we do have these anti-inflammatory biologic therapies for people because it's nice to finally have some medications that really can help. Are there any lifestyle modifications that you recommend to people? Are there anything that people, non-pharmacology related treatments?
Yeah, this is another big area that's controversial, is maybe not the right word, but where there's just a lot of uncertainty. And like with lots of other chronic inflammatory diseases, like if you go to online message boards for HS or things like lupus or inflammatory bowel disease, you will find people who are very passionate about things like dietary changes they made that they feel like were very helpful for their disease. And that's probably true for some, that maybe that there is something environmental that, again, is sort of stimulates a bit of an inflammatory response and makes things worse. And if you can find out what that trigger is, maybe by changing it in some way or removing it in some way, it can be helpful. But I have a lot of patients who have tried a lot of those things and haven't found them to be helpful either. So it's probably just like medicines. There are some things that are important in one person's disease and they don't matter at all in somebody else's. Or it's just very hard to predict. But the biggest things that get targeted when it comes to looking at discussions online or with things like patient support groups is probably, dairy as a dietary trigger. And that's been looked at a little bit for acne. And there have been a couple of small studies that show maybe dairy avoidance is being somewhat helpful in HS. But again, those studies are small and it's really hard to back up and it probably doesn't make a difference for everybody. And then you can see the more extreme things like, paleo diets or diets where people have to have like almost no carbohydrates and no dairy. So like no flour, no dairy, no sugar, like people talk about sometimes. So that's just a very hard thing to do. It's a big effect on quality of life to try to remove these very broad triggers where you just end up eating nothing but white rice all the time. And it's just not feasible for most people. And so those questions come up in my clinic sometimes. I kind of say that dairy gets targeted, reducing carbohydrates maybe is helpful or sugar is helpful for some people, but it's really hard to say. And there's whole, sort of similar discussions around certain supplements like turmeric as being anti-inflammatory and again, not limited to HS. This is like across all inflammatory diseases. You hear people talk about things like turmeric and vitamin D and zinc supplements. And there's a few small studies around a couple of those things showing maybe modest benefit. But for most patients, they end up not being enough. So they're reasonable things to add on, but often it requires more than that to sort of really control somebody with severe disease well.
And probably most important, I would think, would just be eating a balanced diet and not being so restrictive that you're not getting the nutrients that you need just for your body to function. Speaking of support groups, I would imagine this would be really important for patients to have like a network and a community that they can go to and talk with other people who have this condition, since a lot of times people feel like they can't do it so openly. Do you have any websites or groups that you really recommend for your patients?
Social media has actually been a huge help in terms of like patients being able to find a diagnosis and get decent information. Without that ability to connect sort of somewhat anonymously online, I think a lot of patients, again, were even more likely to suffer silently and not understand what was going on. So there are some very large, support group organizations that are online through social media. Some of those groups are open for discussion. Some have closed where you have to join and it's kind of more moderated. I do work with Hope for HS, which has different chapters across the U.S. We've got our North Carolina chapter. We historically did in-person groups, but with COVID, most of our stuff kind of transitioned over to virtual support group meetings. So we do those every couple of months still. And there's different chapters in different parts of the U.S. of Hope for HS right now. There's also like HS Connect, which is another big group that are big advocates for research in the HS space. So those are probably the two biggest would be like HS Connect and Hope for HS. But there are others. I feel like I'm going to feel very guilty for ignoring some of them because I know there are some others and I know the people who have helped lead those groups, but those are two good ones to start with. There's the HS Foundation, which is a nonprofit is mostly physicians. We also have patients on our board. And so we do a lot in terms of trying to raise awareness and advocacy, put out, things like research summaries for updates for people online. So the HS Foundation website has a lot of great information about HS and, what resources are available to patients and physicians or other people in the medical community who are treating patients with HS. So I'd give a shout out to kind of any of those groups I think can help provide useful information and support.
That's great to have some good options that are providing good information. And I can definitely include those names in our show notes. You've kind of touched on some of the myths surrounding HS, like smoking, obesity, not due to sweat glands. Any other kind of misconceptions or myths that, since we've got you, an expert on HS here, that you can kind of dispel for us?
And we talked about hygiene and obesity and smoking. Those are kind of the biggest things that sort of tend to stand out or sort of be misinterpreted. I mean, there's sometimes this myth also that like it's a disease that there's, there are no good treatments. We talked about a lot of treatments, but patients do show up and are told, I'm sorry you have this thing. It's really miserable. And if another abscess pops up, come to the office and I can lance it for you. And it's a painful experience every time. But they're not really sort of pointed in the right direction of there actually being other treatments available. There is something that can be done about it. But even though it's imperfect, we struggle sometimes to get people great control. We can often do a lot better for them. And things like, one other myth that comes up sometimes too, are there things like incision and drainage procedures aren't right to do that, like you're going to make the disease worse, but a lot of times, if a very bad abscess forms, you can imagine it's extremely tender. People can't use their arm if they have a big abscess under their arm and they're told you shouldn't lance it because it's going to get infected or it's going to make it worse in some way. But when people are miserable and have a ton of pain, doing a small procedure like that can make a big difference for patients. And then, surgery, the idea of it being sort of the last ditch effort or the very last thing that has to be done, I think is also something that's not quite right a lot of times. So some patients have very progressive disease where they've got it all over the place, lots of different body areas. It's still kind of spreading around all the time. And with that patient, you do have to focus on really calming it down and stabilizing it. But there are some patients where, maybe they had very active disease in their teens and 20s and 30s, and over time it's had a chance to calm down some, but they maybe just have like one or two stubborn areas that keep on flaring over and over again where some of those tunnels have formed. So they don't have progressive disease that's spreading. They just have a couple of really stubborn things left behind. And for that patient, even if they don't have the worst disease you've ever seen, getting rid of those two spots for them means you've made them 90% better, right? So like surgery can actually be, it's a treatment that goes along with medications, and occasionally should be done by itself even potentially, but it's not something where you just have to wait for everything else to fail. Or if the patient is, a lot better on medications saying, oh, that's the best we're going to do, surgery is a way to get people even better from there a lot of times. So when people have been discouraged getting surgery by surgeons who maybe aren't as familiar, things like that, that's where pointing them in the right direction where the right type of surgery gets done is really important.
Absolutely. I definitely see those patients where it's a little focal area. That's really all they have. Yeah, just remove that. They're trading that sort of large plaque scar that they have for a thin little line, and they're usually thrilled to have that outcome. So great myth busting there, Dr. Syed. I'd love to know, if a patient comes to see you in clinic for HS, what is sort of your next steps? What do you do when they come in? Does this require a biopsy? Do you have to do a lot of blood work or imaging? Sort of what are the steps when someone comes to see you and they think they have HS?
Yeah, so there is not usually need to do much of a workup, right? There are lab abnormalities you can find. Like we know these patients are more likely to be diabetic or the higher risk of things like heart attacks and strokes when they're older. Those aren't things I'm usually going to deal with at a first visit. There's a million things that you sort of could think about as far as associations. But if the diagnosis is in question, if they don't come in sort of already knowing what they have, then there's simple criteria which don't require any labs or biopsies. It's the typical lesions, abscesses, nodules, or the tunneling type areas, and the typical locations, and happening over time recurrently. So like if somebody's had disease for more than 6 months, typical lesions kind of coming and going, and say, pretty likely you have HS. And if they have a family history, that's even more suspicious. It sort of really increases that suspicion that it's more than just a couple of ingrown hairs. And then from there, it's figuring out, how bad the disease and what does their future treatment look like. If it's just, bumps that are occasionally coming and going, that's where some of those are some of the treatments we talked about, whether it's antibiotics and laser hair removal, things like that might be beneficial. If they already have very advanced disease, that's where we talk about some of those sort of stronger, more long-term ways to control their condition with medicines like the Humiras and Cosentyx and other sort of similar medicines to that. And then also kind of planting the seeds for surgery. Like if they have a lot of tunneling with medications, I'm going to make them better. But if they've got that advanced disease, probably surgery is going to happen at some point, 75, 80% of the time. And so I'm going to tell them, we do the best we can with medicines. We're going to really try to stabilize it. We got to put the fire out. Once the fire's out, if there's been some, this is sort of too casual of something to really say, but the analogy is, once we put the fire out, there's time to, if the building has been damaged, if there's, something that has to be fixed afterwards, then you go on to remodel afterwards. So the first idea is, put the fire out, and then with surgery, you might have to fix what damage has been done in the long run. And so planting that seed early of, we're not talking about surgery today, maybe, or sort of in 3 months from now, but there's a fair chance that might be necessary to get you the best you can be, because I'm going to get you partially better with medicine. Down the road, once I've sort of proven that to you, that I can make you better, but this area here may not be all the way better. Like, that's what we're going to talk about next steps. And I think it just kind of sets the expectation that, I'm not going to fix this all tomorrow for a patient with really severe disease, but with time, you're going to be able to take these steps to get there.
Yeah, it's not a quick one-time visit. This is like a relationship. You're going to be seeing that patient, and it's a chronic condition. We don't have a cure for it at this point. So that's a great approach. I would love, Dr. Syed, for you just to give us your final top 3 pearls for someone who's listening who thinks they might have HS, what they should do, what they should know.
Yeah, absolutely. I mean, the first thing I'd say that if you, again, HS is often sort of mischaracterized, misdiagnosed. Yeah, again, if you are getting, recurrent lesions, they've been happening for a while. Maybe they were sort of spread out, even a couple of years apart to begin with, but have become more chronic and more recurrent more frequently. That by itself is very, very suspicious. So and often in a family, other people might have talked about it. Like, we get boils sometimes. This is how you deal with a boil. But most people don't have to deal with boils all the time like that. Like, that's very suspicious that something is going on where there are changes that could be made to try to make it happen less often. So, don't ignore the earlier symptoms and sort of chalk it up to something else. If it's recurrent over time, it's worth intervening sooner rather than later to prevent all that long-term damage from building up, because it's much harder to fix things once all that scarring and tunneling is developed. So, sort of sooner rather than later, trying to find help is really important. The second thing is, again, it's not something that you did to yourself. Again, this is sort of the idea of all the stigma and perhaps even the wrong thing being told to people over time. And I say this to patients all the time, this isn't something that you did where you exposed yourself in some way, or, you sort of, doing the wrong thing. Even if somebody is overweight or a smoker, there are a lot of people who are overweight and smokers who do not have HS, right? So it is more than just that, and sort of, chalking it all up to something you did. You wouldn't blame yourself if you had rheumatoid arthritis. You shouldn't blame yourself if you have HS, because these things happen regardless of all those sort of outside influences. And there are things to do to make it better over time, right? It's usually a good trade, even if a lot of the medicines sound kind of scary. HS itself is really, really hard. And so, even if some of the treatments sound scary, usually those things are a good trade. They make life better, or those treatments shouldn't be continued in the long run. So you figure out pretty quick if those things are worth doing, and it's better than living with the alternative, which is untreated HS. So it's worth trying to do something. And to find, good help, I think engaging with some of the support groups we talked about earlier is one way to find good word of mouth referrals. I think, dermatologists can be guilty of it. Surgeons can be guilty of it, of not wanting to engage enough with HS patients, that are sort of being very focused on other things. And so if you've had bad experiences, using that word of mouth to find providers who are going to be caring and sort of want to treat HS patients, or things like the HS Foundation has a website with a clinic finder page. A lot of states are represented on that. There are lots of parts of the country that do not have people who are real experts in HS care. But if you happen to be near one of those locations or can go, those are people who can, I think, really point you in the right direction. And the number of those experts and people on that website are growing all the time. So that's a really useful resource of how to get started.
That's wonderful. Well, great. And they can also come see you in North Carolina, right, Dr. Syed?
That's right. I'll tell you, I'm drowning right there. Way too many patients with HS. Just to put it in context, I've seen a couple thousand patients with HS over the last 8 or 10 years or so, and there's a wait list of 200 patients, and so it's taking me a long time to get through all those. All my other faculty at my program see a lot of HS patients now, just because I think people generally in the state, think of UNC as a place to send HS patients, but we need more providers in the community taking care of HS also and doing a good job, because there's just a lot of people out there. You have HS and you're listening, you are not alone. There are a lot of other people like you, and there are, again, whereas in the past, I think, maybe people have not been as engaged in the medical community with helping. I think it's getting better. And my hope is that 10 years from now, every state, has an expert or multiple experts, and it's much easier to find that good care.
Yeah, I hope so. Well, Dr. Syed, this has been super educational. I've learned a ton, because it has been a while that I've discussed HS other than from a surgical standpoint. This has been really educational and insightful for me, and I know for the audience as well. If you can, do you want to share where people can find you or follow you? If I think you said when I emailed you don't have social media.
I've debated, starting some sort of social media following at some point, just to give tips directly to the community and stuff. But I've just not found the time because I'm just stuck in the clinic all the time trying to take good care of patients. And so I have not found time to integrate it in. The HS Foundation website, I think, is like the best place to kind of check in. They do have a social media feed. If you're interested in supporting the HS Foundation, we sort of are all volunteer organization. It's a lot of physicians and patients who give time, and we do things like, we're about to do another round of grant funding, where we're basically, providing funds for researchers to get started in their HS research careers, grants for people to come and, sort of shadow with other people who are experts in HS to be able to learn more about it and start, specialty clinics in their own community. So HS has your attention, you're interested in helping all the patients that suffer with it. We're all doing our part volunteering, and anything that comes in to support the HS Foundation, we try to put to good use.
Well, thank you for all that hard work you're doing beyond seeing your patients one-on-one with the HS Foundation. That's really awesome and admirable. And I really appreciate you being on the show. Thank you so much.
Very glad to do it. Thanks for bringing some attention.
We'll see everyone next week. That's all I've got for this week's episode of the Skin Real podcast. But here's some great news. One of the most valuable things you can do to help me and other new potential listeners to find my show is for you to both rate this show and leave a review. So, as a special bonus for you, if you leave me a review, take a screenshot and email it to info@theskinreal.com, and I will send you a thank you free PDF on skincare truths versus hype, because I love spreading the word of good, truthful skincare. And please be sure to share with your skin friends so that we can get the word out there about real skin. And until next time, remember, no matter where you are in your skincare journey, always remember to love the skin you're in, because real skincare from real experts can be real simple.